Assalamu alaikum. I'd like to welcome you to what will inshallah be the first of a number of episodes concerning medical matters. My name's Dr. Adnaan. I'm very grateful to Newcastle Fast FM for giving me this opportunity to reach out to you all. To give you a bit of background about myself, I'm a medical doctor. I've studied and trained in many places, in Cambridge, in Harvard in America, in Oxford, Nottingham, and I've worked in the UK, and now I'm currently in Saudi Arabia in Jeddah working as a consultant radiologist. My main area of interest is imaging for cancer, and so I work as part of a team where we treat and bi'idhnillah cure patients with cancer. The reason for this series is that I've seen an explosion of information online and in social media concerning medical matters, and some is quite accurate, but a lot of it is inaccurate, and unfortunately some people following that advice have actually come to harm as a result of that. So what I wanted to do is try and turn the tide and put out some accurate information from appropriate sources and from experts, ultimately to try and help my brothers and sisters who may be facing difficulties of illness and different diagnoses. The plan or the idea that I have is that in the initial episode or few episodes that we will talk about common misconceptions which are out there, and inshallah which we should be able to handle and respond to fairly easily, just to clarify these ideas to people. But my longer term plan is to actually invite experts onto the show, and I will then ask them, and you can hear from the horse's mouth, from the experts, what is the detailed information about different conditions and different diseases which people may have. And I hope inshallah that we will be able to have a facility where you can actually put questions to these people and then get the answers that you need. And hopefully with time we might be able to do that in a live fashion as well. One thing I want to mention before we start is that this is advice obviously in a general sense. Inshallah it will be accurate advice, and we will refer to experts, medical experts and so on. But this is just advice, and if you have a specific clinical problem or if you have a specific illness or something's happened to you, you still do need to go to see your doctor. And that's important because they can assess you properly, they can see you, they can assess you, they can do tests, and then they will be able to give you a holistic and balanced assessment and an accurate assessment of what you need specifically for you, and that's also important. Okay, so what we'll do is we'll move on to the different questions, and then we'll be able to assess and respond to them as we go through these different topics, inshallah.